course, we do have some final tips for you to run through, and really the number one thing is to remember, read the case thoroughly. This is an exam that's about nuance, about understanding the case or the patient that's been put in front of you in the context that they're describing. So focus on that patient history, the examination findings, and the context of the patient, because that can have dramatic implications in how you answer that question. Try and avoid skipping or glossing over key information. I know it's easy to sometimes put patients into pigeonholes, and this is an exam that you will miss marks and you'll be caught out on different things if you do that. Make sure your answers are relevant to the scenario. Again, sometimes if you're repeating enough practice questions, you'll notice common themes amongst them, and it's easy to kind of fall into the trap of saying, oh yeah, this is a older patient, so we'll refer to geriatrician, but it may be they're actually just under the age thresholds for that in some regards, or let's say one of the default answers for a question might be referred to a pediatrician and it's a geriatric patient. Extreme example, but you really need to make sure that each thing is actually relevant to the case that's put in front of you and their context. So pay attention to the evolving information in the case as well. Often there'll be a stem that's provided, and as the questions progress, as the case progresses, additional information is planted. Pay close attention to that, because they are giving that to you for a reason. They are trying to tease out additional bits of information, and so again, does that change your answers? Does that change the context of the question? It should. And you should be reflecting that in the answers that you provide. So when it comes to actually answering, make sure that you provide detailed and precise answers. Try and give the sides of the patient, if it's a right arm or left arm, if this is acute, if this is subacute, if this is chronic. Really spell it out. And I know at times it feels like you're saying, well, of course they're going to know that. Yeah, maybe. You need to prove that you know that too, and the only way to do that is to state it in your responses. With that as well, try and avoid vague terms like healthy eating. Try and specify, meal plans, calorie counts to reach specific kind of food products to be eating or avoiding. And stick to the number of answers requested. This is a really easy trap to do. I've done it myself on the exam day when you're rushing through, trying to get through as many answers as possible. Make sure you underline, circle, have some way of flagging to yourself how many answers they've asked for and how many answers you've given. And tied into that one as well, really, because it is a form of overcoding, but try not to overcode with unnecessary information. If you find yourself using if, and, or, but, or commas, those kinds of things, you're probably joining answers, in which case that's going to fall into overcoding territory, and you will not only not get the marks for the additional information you put there, you will lose marks. They will subtract marks from your exam, which will have an obvious massive detriment to your overall performance. Now, make sure as well that you're using up-to-date clinical guidelines. So make sure you're only using the latest ones. Try and avoid anything that's more than a couple of years old. And really ask yourself, is this practice outdated? Is this something that used to be done that I probably need to just refresh myself on and make sure this is still the way it's done now? Because it's incredible how quickly information changes. This is also something where make sure you're familiar with the latest standards. So if you're using things, pardon me, like coughing into a microphone, if you're using things like Heart Foundation guidelines, make sure you're on the latest version. If you're using COPDX, make sure you're in the latest version. Try and track down. And a really important thing is usually at the beginning of each of these kinds of documents, you'll find a summary of changes. So it's a really handy way to just quickly refresh yourself on what may have been different from the last release, in which case that may change the responses you give. And again, make sure the guidelines are contextually relevant to the case. Now, time management is critical for such a long and busy examination. So one of the things I try and do in here is to allocate you around 2 minutes per question, because that's roughly how long you want to be spending in the exam to make sure you also have a bit of time left over to go through and flesh things out or fill in things that you may have skipped over. And so if you're finding that you're lingering, if you're spending too long on one question, it might be worth finding a way to flag that and try and come back to it later. But really important is that you do complete all questions. Even if you don't think the answer is correct, you don't lose marks for incorrect answers. You might get 0 if you do something dangerous, so don't do something dangerous. But try and make sure you at least get something down, or the number of responses per question, to just try and maximize the chance of getting those answers in. It's incredible how even a few extra points can make or break your exam results. And of course, make sure you're keeping an eye on the clock all the way through to make sure you're actually hitting your kind of time targets as you go along, to make sure you're not going to run out of time at the end. Really handy, and the RACGP releases reports every single year of the KFP exam breakdown. I know it's a bit tedious, but it's actually really valuable to read through and kind of see, well, what were the things that actually caught people up? What were the traps they fell into? And it's incredible, you see the same things appear again and again. And so that should be good little reminders to yourself not to make those same mistakes. See if it's something you find yourself slipping into, in which case, spend a bit of time, spend a bit of effort in these last 10 days in perfecting your performance in that particular niche. Really important is to avoid missing those contraindications in treatment plans. Often there'll be an allergy that's kind of snuck in, maybe a bit more subtle, or there might be a comorbidity that precludes treatment with a particular medication or particular non-pharmacological management strategy, and you have to tie that into your answer, because while again it might be a pigeonhole, this patient I do this, it may not apply in the context of that patient. And again, then try and consider those social and cultural factors in the patient care. This is particularly relevant when you're looking at patients who may live in a rural setting in regards to accessing additional services that may not be readily available. You may have to think a little bit more on your feet on what you would do in that situation if you were a bit more limited with resources. And so again, focus on managing those medical and non-medical issues. If they're giving you social information in the STEM, it's probably relevant, and you should be acknowledging that in some way in at least one of your answers.